Coming out to hear memoirs, a little about medical progress.
Next time.
You all know that I'm Bob Harris, and I want you to meet my daughter, Nancy Knudsen, and her husband, Dr. Knudsen. I got 3 kids that are retired already. That makes me
Turn on your mic, Dan. Did you turn on your mic? Your mic.
What?
The microphone. Did you turn it on? Yeah.
Yeah, I think it's on.
Is it working?
No. Yeah?
Get hold of it, so see your kids get hold of it. So, you know.
The light was on.
Yeah, I can hear it on the speaker back here.
Nice, don't we?
Nan, the speaker back here is sounding when he talks. You're good.
There it is.
No?
Is it on now? They can turn it on. Your grill there.
Say something again.
Say something again.
Hello, hello.
Yeah.
Okay.
You're fine, Phil. You're wired.
I need to. Anyway, it's such a pleasure to share some of my memoirs as a family physician, and also to reassure you that medicine is not going to fall apart. It's going to keep going. And I'll identify a number of things that are improved that we can be proud of. But I'll end up by saying that it's important that you take your own responsibility for yourself. And just because you didn't go to medical school, it's your body and it's your control, and you should remember that. And of course, don't worry about health or illness, manage it. That's what I'm trying to tell you. When I practiced 40 years in Rockford, I tried to help people do that. But I was surprised that so many people didn't give a damn. And I'd like you to give a damn. The other thing is that you can be assured that whoever you are, you've got an immune system that can overcome a lot of infections that you don't even know you had. But the ones that we can detect and help, we want to help. So these are the 2 mottos that I've had for over 20 years of retirement. I'd like to start off by some fun. I'll have several funny stories. I was born, and I was delivered by Dr. David Danforth, who was the head of obstetrics, and a nice guy. I didn't know that for quite a while. But anyway, he had several places in my life. First of all, he delivered me. And then I grew up, and I graduated from high school. I drove a cab in Evanston, went down to Chicago and stuff like that. And I had Dr. Danforth and his son and Dr. Danforth's fiancée in my cab, taxi cab. And I took him down all the way to University Club in Chicago, down by the Loop. And he was going to Europe, and his fiancée and his son had given him an escort down there. The next thing I found out, when I was a senior at Northwestern, I took 2 rotations at Evanston Hospital, one in OB and one in surgery. And both had real meaning for me. That'll bring a smile on your face. Number one, I was a clerk to Dr. Danforth, but I didn't tell him he was in the taxi cab years ago. But I did tell him that he delivered me. And he was a clever little guy, and his famous thing was push, 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 push. The women know what that is. Anyway, I didn't hear about Dr. Danforth until I was interviewing Dr. Gurley for deanship with several other people of the medical school here. And Dr. Gurley and I both were from Evanston, and his father was a distinguished person in the pediatric academy. And he said, oh, I told him that I had Dr. Danforth in the cab and so on, and which was kind of funny. And he said, oh, did you hear the rest of the story? After his son and his fiancée took him down to, they got married. Not to Dr. Danforth, but to his son. So his son was scowled at over the Evanston Hospital. They didn't think that was a good idea. But anyway, it worked out, and it's kind of fun to start off. But there's another exciting thing that happened. I had what was called infection, or hemorrhagic disease of the newborn. And newborn babies sometimes would bleed from the nose or mouth or whatever, and it was something to fear. But I got a blood transfusion in my head. And my father told me this, that they matched my blood with my father's, and they put it in a little porcelain bowl and stirred it up with an anticoagulant, and the doctor put us in my soft spot, one of my soft spots. We have 4 soft bones, and they don't solidify until a long time later. But anyway, if anybody said I'm crazy, I got holes in my head. I had them once, but they're healed. So anyway, the thing that I like to tell you, that I was part of the study that eventually found out that vitamin K deficiency was the cause of the bleeding. So every baby now, or did when I was in practice, got a shot of vitamin K, whether they needed it or not, because it was a simple thing to do. So that was part of medical progress that I wanted to let you know. Excuse me, come in. Come in and help yourself to
what?
a book.
Is there receipts paper?
Yeah, there's 3 over here. Oh, there are some back here.
Later on, my
Can I put that back
sister
in
came
there?
down with a strep throat, and she became septicemic. In other words, it went into her bloodstream beyond just
Sit here or what?
scarlet fever.
Here together.
And of course, my father being a milk wagon driver, they put a quarantine sign. They don't do that anymore because he dealt with food. But she, the pediatrician made several house calls that week in 1933, and she eventually died at the end of the week. In the summer of that year, in 1933, they marketed sulfanilamide, which cured the disease. And I had a friend in college that had the same disease that same year, and he got the strep, or the sulfanilamide, which is one of the earliest antibiotics. And so he got well. So synchronicity, if you get something at the right time when they're marketing something that works well, it's good. But so many of us, or so many people miss a deadline. So anyway, the next thing I'd like to talk about is something that I think is marvelous in terms of human cooperation. When we were in grammar school, we had smallpox vaccination, and they put a plastic cover on it so it wouldn't spread. And I never saw a case of smallpox, And we didn't have any in Evanston, but it was worldwide in terms of epidemic at times. And so I'm glad to tell you now that there is no smallpox in the world. The medical profession and a lot of lay people, service clubs, pooled together. And the only smallpox is in the laboratory in London or Moscow. So that represents progress. It's worthwhile. In grammar school, we got diphtheria vaccination for tetanus, lockjaw, diphtheria, and whooping cough. And that's called the triple vaccine. And that has done a lot of good in terms of eliminating the disease. However, when I was in Rockford about 5 years, I did a little surgery on a guy's toenail in the hospital and sent him home the same day. And later in the afternoon, his wife called me and said, Joe's got a big fever. And I thought, uh-oh, something went wrong with my toenail surgery. So I went out and made a house call in West State Street. And I looked him over, but I saw something I didn't see before surgery, infection on his tonsils, and it was a little plaque, little dirty white thing. And I thought, oh, this looks like diphtheria. In those days, I was real scientific in my work. I had a culture. So I took a culture of it, and it was. Took it back to the lab. So that diphtheria case back at about 1959 is the last case in Rockford. But he got along okay. Diphtheria mostly, when it occurred in young kids, it would close the trachea and suffocate. So in adults, our organs are bigger, so it doesn't happen. So smallpox or diphtheria is hardly known today. The next thing that interests me, I want to tell you about is poliomyelitis. I really had a lot of trouble at work. Poliomyelitis was an epidemic. It was around 1950, and especially bad in Rockford. And I had several patients. You do a spinal tap and you send it to the lab, and if it doesn't show meningitis, it's polio. So I took care of some of those patients. But the patients that were the most difficult to take care of were the bulbar poliomyelitis that affected the brainstem. Actually, polioencephalitis was the original name, meaning it started in the head, but it also was in the spinal cord. So anyway, poliomyelitis was a real problem. But the difficulty in managing a bulbar polio required iron lung. And I hated those damn things. They were so difficult to take care of a patient. They had ports and so on. And the iron lung had to be, with the legs elevated so that the secretions in the lung and bronchial tubes would flow upwards. And then we had a catheter that went through the nose and picked up the secretion. And you had to take care of that catheter so it wouldn't injure the throat. But also, some needed a tracheostomy down here. And that was where the collar was for the... So I had to make several times three calls in county hospital to coach the nurses, because they weren't the regular staff, they were in the registry. So I remember it very well. But I also remember it because I had a good doctor teacher at Evanston Hospital named Dr. Seifert. And I persuaded the medical society to invite him out to talk about managing bulbar polio. And because you lose a lot of those patients. And so he came out and we had a wonderful conversation. I took him to dinner and he instructed the doctors that were there how to manage bulbar polio. So we were all on the same page in terms of management, and it was a cooperation in the medical society that I valued very well. The last thing I want to mention in terms of disease is TB. Tuberculosis was a kind of disease that was kind of mystical, I'd say. They didn't know much about it, and I don't think the medical profession did. But anyway, the treatment was fresh air, one of the treatments. So when you made rounds in a TB stand with your patient, usually you had to turn them over to the TB expert. But when you went there to visit, it was cold. The windows were all open in the middle of winter and so on like that. That was a dumb thing to do because eventually there's an antibiotic for tuberculosis, and several in fact. And we had that here in Rockford, and it was well taken care of. So that represents a lot of progress in terms of treatment and that we can be proud of. I was taught at Northwestern to treat a lot of diseases, but they didn't teach us much about prevention, just the vaccines, that's all. So there's been so much learned to the public if they get the message to avoid disease that I'd like to talk to you about. The prevention was done with mainly, like I say, the vaccines. The body has an immune system that when it's challenged by a disease, the normal response is to trigger an antibody. So the antibodies come out and they beat up on the germ, and it usually helps. Some people have weak antibody system, so there is a challenge there in terms of treatment. One of the things is that we were so busy treating stuff. I can remember at Northwestern they taught me a lot of treating things, and the one that I liked the best was sometimes pneumonia had pus that accumulated in the chest wall, and we were taught to percuss and see where the bottom was to get. We put in a drain. That was fun. Because you felt like you were really doing something. And that's what a lot of doctors feel. They feel accomplished. But some of the less publicized things are related to nutrition. We didn't get much nutrition instruction at the medical school back in the 40s. And I'd like to recommend a book that one of my daughters got through Amazon. It's called The China Study, and the author is T. Colin Campbell. And I'll leave it here so you can copy it down. It would be worthwhile for you to get or give it as a gift to your wife or your husband, because Dr. Campbell just mobilized a lot of good science that showed that by changing your diet, you can avoid coronary artery heart disease. And it isn't anything flashy. You don't tell somebody to eat vegetables. You don't feel like you've done a lot, but you've done a lot. when you do that. The essence of Dr. Campbell's book was that vegetables and whole foods and as little protein, meat, as possible. We taught about no fat, but there's also protein, so that the protein would be a small part of your diet, not the main part like we have in restaurants and so on. So anyway, he documents, he got the Chinese medical profession to do thousands of people where they only ate vegetables and they got very little meat. They had very little coronary artery disease. In fact, the ones that began to have symptoms of coronary, it went away. So this is something that I'd like you to think about and perhaps even go buy a copy. I don't get any commission out of it, but anyway. So as I retired, I still felt, I didn't feel burned out. I loved what I did, and so I started doing health talks in senior residence. And it's amazing how many people don't know a diddly squat about health, how to manage themselves. And it's understandable because all of us come from different ethnic groups, and the ethnic groups do the stuff that tastes good, and they all have health. They didn't think of it in terms of health. But we should think of it in terms of health. I'm 97, and I eat more meat than I ought to, but so what? But you people that are younger, you CLR should pay attention to it. So anyway, I was doing a health talk out in Lanark, and a social worker from Ogle County had this Senior Good Health Journal. This was about 20 years ago. And since I've distributed around northern Illinois and southern Wisconsin 4,000 of these. They're just guidelines to your health, a checklist. And don't take it in and say to your doctor and say, I want to do this stuff. Don't do that. He'll be mad at me too. Like the television people, you know. Anyway, I'd like you to go in and share it with your doctor and ask how he will do with you. Because, like I say, in the early days, we treated stuff and said, hey, I came up with a nice thing, and I feel good. But nowadays, it's less traumatic. You're more prevention, and the new health thing that's coming out in this year and the next is aimed toward prevention and early detection. And these two elements were things that I was I had very little instruction in medical school. So medicine has changed, and I think it's changed for the better in many cases. But the thing that medical profession has lost or is losing or is not paying attention to, rather, is the personal aspect. Because there were so many personal aspects that I treated patients and I enjoyed it. And before I go into walk you through the Senior Good Health Journal, I'll tell you about an old gentleman that came up with a new patient. I hadn't seen him before. I picked him up in the emergency room. And he had gangrene of one foot, one leg. And I called in a surgeon, and the surgeon said, you need an amputation, and the guy just about panicked. But after the surgeon left, I told him that I had met Dr. Howard Russ, who told us how family physicians could do a lot of rehab thinking in their head at less expense for the patient. So he finally consented to have his leg amputated below the knee. And I prescribed, as Dr. Howard Russ suggested, a wheelchair with the wheels set back, so with the loss of the weight, the counterbalance, it wouldn't tip over. So we dismissed him, and his wife called me up and said he can't get in the bathroom with a wheelchair. And I forgot to measure the width and do that. So what did I do? I got a chisel and a hammer, went out and made a house call on that housing area out on 15th Avenue, and I removed the molding and the wheelchair. He was able to wheel into the bathroom, and he was happy as a clam. I don't think I even charged him a house call. Anyway, I'd like you to turn to the Senior Good Health Journal, and I'll just walk you through it. I'm not going to go in detail a lot because you have to read it, and read it with your cohort. It's something that's positive. In other words, this will help you manage yourself. And this is printed in the East, and the first batch, I shared the cost with the senior Northern Illinois seniors. I got the Medical Society to ante up for another batch, and my daughter set up an endowment, and the medical school has been paying for it. So that's why it's free. The only thing in medicine is free. I'd like you to open your Senior Good Health Journal and see the top, it says personal information, but they caught the message too. Take charge of your health and wellness. And that's so important, because if you're eating wrong and you're driving yourself into a disease of some sort, you don't want to do that. So it's a good thing for your self-preservation, and you're important. You really are. Then, of course, the next page is room for family medical history. Sometimes there's compelling evidence that there is some hereditary diseases, so it's worthwhile knowing what your relatives have. And then, of course, here come the health tests. When I first started practicing in Rockford, if a doctor wrote an order for a health test, you had to justify it with an insurance company. Nowadays, you don't have to go to those many of these screening tests, because they do detect early diseases, like I call them stealth diseases. If somebody's going to get diabetes, they don't have any symptoms for a long time, but it's doing harm to their blood vessels, to a variety of areas, so you need to schedule with your doctor routine tests every so often that is reasonable, and is paid for by the insurance companies in most cases. So they have the 2 pages with health tests for adults 55 and over, and there again, those of us that are up in about 55 begin to have different diseases that are stealthy that we don't know, but if you can pick them up early, you can head them off. And that's so important. And like I say, the medical school is teaching this prevention and early detection. I like to call it detective medicine, but it never is caught on. Anyway, we call it prevention. So you'll see that those tests are relative, and some doctors are more concerned about some of these things than others, or he doesn't think you need them. So anyway, discuss it with him. It's not accusing him of anything, just sharing the relationship. The immunization schedule, you still need immunizations when you get up. And I'm a bad example. October a year ago, I came down with the shingles. And it didn't look like the shingles, because what I saw is practice. People who had shingles had it on their chest or the abdomen, and occasionally the face. And it was painful, and it was blistery. This was on my leg, my thigh, and it wasn't a blister, it was just a couple of red spots. But one day I walked out of the garage and I fell down because it affected the nerve. Well, I didn't know. It didn't hurt at the time. So Robert crawled out of the garage in the afternoon. It was about 50 degrees. And I turned on the hazard flasher of my car, and some kind lady came by and helped me up. But eventually I had to go over to the hospital overnight because I also had a fracture of the small bone of the... So that was all caused by shingles. It's also called herpes zoster. And it's related to chickenpox because it's thought to be the chickenpox you have when a kid or you're susceptible to it in older life is sequestered in the nerve system, and something triggers it, we don't know, and it affects you. Shingles vaccine is available, and by golly, they even do it at Walgreens, so that's how good it is. But it wasn't good when I was practicing, so I'm excusing myself for having a shingle. But I'm still limping a little bit, and I need a cane occasionally. So I encourage you to talk to your doctor whether you should have the shingles vaccine or not. And that's a modern prevention that really works. And if I've been having it affect me for a year and a half, not heavily, but a little bit, you watch out, you get your shingles. So that's one. You also should have tetanus every so often, about every 10 years. And when I got my flu shot at the health department, they also have pneumonia shot. The pneumonia is good for about 10 years too. So keep you up to date on your immunizations. Just don't forget about it. You may have some allergies that need attention. And the thing is, help your doctor help you. I had a patient one time that came in and I said, "What's your problem?" "Doc, that's your problem." That's why I came here. So he was still mystified and living in the old type of medicine. Doctor, treat me and get me well and go home, and I don't have to do anything. You have to cooperate in everything and understand as much as you can and ask the doctor questions. So help your doctor help you is important. Don't let yourself be hurried, and that's the problem. My staff often complained that I was too slow. But the patient needed the time, and I did it. And some people understood it, and some didn't. So anyway, and another example that has gone by the wayside is house calls. I can remember one time being in the record room at the Swedish American with Perry Anderson. Many of you may know Perry Anderson. He was an internist, a wonderful guy. And as I was doing my records, updating them, I heard him say to this register, give him a list of the house calls he was going to make after 10 o'clock. One patient sometime came back to me and said she was in a ladies' meeting. Somebody was complaining that Dr. Ahrens sometimes didn't get there till 10 o'clock at night. And she turned to the lady and said, "You should be glad he does it, not many people do." So anyway, there's a lot of mix that goes on, but you're still the focus of the importance for you. But now that we don't have house calls, we still have intermediate care, which is worthwhile. They have people that are skilled, and they're part of a corporation. in the former editor of the New England Journal wrote a book called Second Opinion, and he was identifying how medicine had changed in the 70s. That was when I was president of the medical staff and had been president of the county medical. So we were pushing the doctors and ethics and taking good care of the patients and not charging too much. So that was what we were busy doing. Nowadays, they don't do that because most doctors, family physicians, and general internists are employees. It's not bad, but it's different. And sometimes they miss some of the fine points that we value. So anyway, you can, by being interested, you can shorten that period, and maybe your doctor will be more concerned about you. So I'm not criticizing them. I'm just saying, help your doctor help you. And that's what it says right here. So I think that's important.
Excuse me, Dr. Harms. I'm Judy Kemp. Excuse me.
Okay. When the doctor prescribes medication, ask him what it is, so how it works, what are the side effects. If your doctor doesn't have time, which is okay, understandable, we now have physician's assistants and nurse practitioners that are more educated, who will also be good educators. And Nancy, my daughter here, is retired, and she's a PA, and some of the things she tells me that she told that the doctor forgot to tell covers it up. So you've got a lot of resources, and that's why I want you to feel confident about the medical profession, because you can be a factor in helping doctors be better. There's the next page, doctor visits. What your blood pressure was. Believe it or not, my last visit to Dr. Troutman, who is my PA, my family physician, primary care physician, you gotta know that and my blood pressure was 120/60. Wow. It's 97. But it's good because I've been paying attention to a lot of these things, and I believe some of this stuff. So I get to know what my data, all the data states that are important in staying healthy. And I encourage, one of the new things that I've seen in at least in Sweden, I think it's both hospitals. In fact, I think all three hospitals are equally good, and they may do something different. But when I finished my visit with Dr. Troutman last time, he was punching out on the computer, and he looks at me too. He doesn't just look at the computer. They gave me a sheet of paper, a summary of my visit. I never had a chance to do that back in the old days, so I compliment the hospital for doing it, and I complimented Troutman. He's special because he's an alumnus of Kalamazoo College like I was. So we got a lot going. Anyway, tests and procedures. You should know what the tests are. I get a test next Wednesday that measures heart failure. I have a little heart failure with a valve problem, so we want to know that. So I feel confident that I'm on the right track. I'm not overconfident, and I'm not going to say I'm going to go to 100. I'll go to whatever I'm allotted. So anyway, the next page, page 12. There's 10 rules for taking medication safely. medication taken incorrectly is responsible for a lot of emergency room visits. And I encourage you to pay attention. I have a sheet that I check off. I take 4 or 5 medicines for my heart and several other things. So I feel confident that I'm doing the right thing. Nothing that I would take would be too dangerous, but I want to be right. So anyway, then list all your current medications. You don't have to list it on this page. I have a regular sheet that do that. But you have to discipline yourself to do this. Then the next 2 pages is dental care. There again, the dentists are pretty good. Many times when you get the teeth cleaned, they want you to have an antibiotic a day or 2 before, because sometimes cleaning the teeth spreads bacteria. Heart health is important, and Dr. Harner has been one of the marvelous cardiologists in town that has educated us all as physicians. But there's new information about heart health, and like I say, you get a lot of it out of the China study, because they have large numbers of patients and are well controlled, and data can be relied on. Facts about high blood pressure. High blood pressure is another element that can really sneak up on you. Blood pressure shows usually no symptoms until it really does harm. So you want to pick it up early. Mine was 160 over 90 before I was treated, and I'm confident now I'm doing better. But there again, it's a stealth disease. It can cause stroke and a variety of other things. So blood pressure, diabetes. Diabetes, when I was in medical school, you tested the urine and it was tested high in sugar. At 170, it would show up. But there again, that between normal of 100 and 170, it's doing harm to your blood vessels and to a variety of your organs I don't want you to run scared. I don't believe a person is hypochondriac. You're just concerned and you're managing. You all are the managers, and I encourage that. And then, of course, there's a page for breast self-exam. You can depend on your doctor to tell you what you want, when you should have for screening exams. Screening tests are when you have no disease, you just are in an age group where you might get disease. So your odds are, it's a matter of playing with the odds. So another thing that Medicare pays for is osteoporosis tests. Men have osteoporosis, and that means crummy bones. And there's several tests that pick it up early, and treatment is available.